Good morning, everyone. Welcome to today's session of lecture series on mobilization and manipulation. Today, we're going to be talking about the techniques that we use to mobilize the spinal part, the spine, the spinal mobilization techniques, or the techniques that we use to mobilize the spine. It's going to be a follow-up to previous lectures that we have had. Some of those terminologies that we have discussed will still be re-emphasized here because some people just have interest in spinal mobilization lectures, so that they don't miss out on all of those terminologies that we have emphasized under peripheral mobilization. That's where we're going to start with definition of and clarification on those terms before we now move to proper techniques for spinal mobilization. All right, so here we talk about emphasizing the differences between mobilization and manipulation again. Mobilization is a skilled passive movement. It is passive movement because carried out by the hand of the therapist on the patient at varying speed and varying amplitude. The speed could be varied, the amplitude could be varied. As you can see in that diagram, the therapist can choose to push the upper part of the patient towards the plinth and draw the waist toward himself, and he can continue to do that rhythmically at varying speed and putting in varying amount of force to do that. So by varying speed and varying force, that will be qualified to be called mobilization. I told you then in those series that mobilization is so much under the control of the therapist and the patient. But when the therapist decided to push the upper part of the joint and towards the plinth and the lower part of the patient's waist area toward himself, alternately to the point whereby there's no more movement, doing that alternately at a point there will be no more movement. We said the joint is locked or the slag has been taken off. So if at that point when the joint is locked, is suddenly delivered high speed or high velocity, that with the distal hand, is suddenly delivered high velocity, low amplitude, that is high speed and low force movement in a jerky manner, or what we call thrust, then it will become manipulation. So with mobilization, the speed and the amplitude varies, but with manipulation is done at high speed and low force, low amplitude. So that's the basic difference between mobilization and manipulation. Otherwise, they are both skilled manual therapists carried out by physiotherapists on the body of patients in order to reduce pain, improve movement and function. Now, at a point, we can also say that mobilization is done with general technique or with specific technique. When do we say it is done with general technique? When the efforts of the therapist during the mobilization is directed to several joints. More than one joint is directed to more than one joint. As we can see in this diagram, the therapist actually is mobilizing the mid-thoracic spine, but part of his effort is also involved in the elevation of the shoulder. So if the effort of the therapist